Good morning, students. Today we will learn about the topic the nursing management of the puerperium period. So, how a woman can adjust in a normal puerperium period. Okay, so that is psychological adjustment or adaptation into the puerperium period. So, you have learned about the psychological changes and physiological changes which the woman undergo after delivery to the puerperium. Yes, we already discussed in previous session of the normal puerperium that the physiological changes in all body system of the woman during the puerperium period means after delivery. Okay. Now let us discuss with the psychological adaptation or adjustment which takes place during the puerperium period. So that is all about the physiological changes means in physical body how the changes occurs and how the woman can adapt. But now we will discuss about the psychological means how changes in behavior and moods, emotions are affected to a woman in the puerperium period. Okay, so these all are as follow. That is, we will discuss now. First one, that is the attachment. So what is the attachment? So a mother is how attached with the newborn baby. Okay, both for both mother and baby, that is the newly experienced, and in puerperium period some kind of the changes also occurs in mother's body. So in that case how the attachment is occurs. So in puerperium period it is a time of transition from non-parenthood to parenthood. Okay, so being a parent, it is a state of non-parenthood to being a parent. So that is the new changes for the mother. Okay, then parent and infant attachments lead to bonding depending on the infant's responsiveness. So a newborn or infant is known to her mother. Okay, so the bonding attachments is created between the mother and baby. So these encourage them to continue the interaction. So the interaction and bonding is maintained between the mother and baby. Okay. So daily routine, by daily experience, the newborn also known by her mother and family members, but very attached to her mother. Okay. So that interaction will be developing day by day. So the bond formation is an outgrowth of reciprocal attachment, stimulus response, and affectional ties that help from the constructive social relationship. So by this kind of the interaction and bond formation, the reciprocal relationship maintained and social relationship maintained between the mother and baby also. Example, the behavior is kissing of infant, bonding, cuddling, and maintain eye-to-eye contact. So by this kind of the emotional behavior or this kind of the bonding will create between the mother and baby, like holding, touching, kissing. Okay, then cuddling with newborn baby, and also maintain eye to eye contact. This is very important while mother is feeding to her baby. Okay, at that time baby and mother's eye to eye contact will be maintained. Okay, so by that the attachment and bonding will creating and developing day by day. So this is the first changes, psychological changes, that is the attachment. Okay, then maternal developmental task. So which kind of the development in mother task also growing. So the stage through which the new mother goes through are taking in, taking hold, and letting go. Okay, so this kind of the three stages occurs for the mother also. That is taking in means holding to a baby. Okay, taking means a baby is on baby with her mother. Okay, so he or she may feel safe and secure with their mother. Then taking hold means tightly holding, okay, by mother, and letting go means for the feeding or any else. So these kind of the three stages of the mother. Okay, after delivery the mother is exhausted and needs some rest and sleep during the first and second day, because she will be taking in the experience of the labor and delivery. and asking many questions. Obviously, mother have taken care of the baby till 9 months, and after the completion of the 9 months, they have to suffer from the labor pain. Okay, so throughout the delivery, mother having exhausted, and she has to take a rest, sleep, and proper rest. Okay, so that they can take care of the baby also. So during first to second day, mother have to take rest. Okay, her physical needs and deficiencies of the nutrients and needs of her infant should be made. Obviously, not only for the mother but also for the baby, family members and mother have to take care of the proper diet and nourishment provide to the mother as well as the baby also. So all physical needs should be maintained by the mother. Okay, then taking hold means period when the mother attend to infant's need. As I told earlier, taking hold means mother grasping her baby in her hand. Okay, so infant needs met by the mother and her own need also fulfilled. So she is usually eager to learn how to care of the child and herself also. So mother have to learn, because for mother that is also new experience. So mother also eagerly for learn to how to take care of herself and how to take care of a newborn baby. So this is about taking hold phase. Okay. Next, that is during the later recovery, the mother must let go and view the child as a separate person. Means after some time and recovery of the mother must let go for the view and child as a separate person. Means how to care of the baby. Okay, those women who have difficulty letting others assist with the care of her child may develop psychological problems. If mother having a difficulty for the letting go period, then the assistance is needed. Okay, in that case, and the care of her baby may develop like a psychological problem. Okay, so the nurse must try to identify the unresolved problem. So in that case, the assistant or nurse will be help for the unsolved problem of the mother. Okay, so mother feels relaxed. These are the maternal developmental tasks. Okay, next, potential for mood changes. Obviously, mother having the many kind of the mood swings, like in first few days after the completion of the delivery and birth of the baby, even 10 to 14 days would be considered as a period of normal, but crisis and disequilibrium, especially for first time of the mothers. Yes, of course, if mother having a newly experience of the baby, then she also exhausted by the labor pain and delivery, so she have to take care of the rest. Okay, and proper care of herself and baby also, so the equilibrium will be maintained in that case, or else the crisis will take place. Okay, but for mother, surrounding environment also maintaining by the happily, because mother having some kind of the stress in that puerperium period. So in that case, we all have to, and family member, especially family member, have to take care of the mother as well as the newborn baby. Okay, so which kind of the complications suffered by the mother, that is the psychosis, blues, and postpartum depression. Okay, so what is the postpartum blues? Many mother having the experience of the mood swings known as a postpartum blues, but episodes of the unexpected crying, sensitivity, sadness generally around 3 to 7 days after the delivery due to stress, fatigue and hormonal changes. Okay, so mother having a face of this kind of the problem in puerperium period, means postnatal period, that is crying, sensitivity, emotional and sadness. Okay, so these kind of the problem known as a postpartum blues mainly occur in 3 to 7 days after the delivery. Okay, so and it will last for the 1 to 2 weeks. Okay, the reason is drop in level of hormone estrogen and progesterone. Some hormonal imbalance also responsible for this kind of the complication. Okay, like estrogen and progesterone is dropped down, then the mother having a postpartum bruise. Okay, next, that is the postpartum depression. Beginning 2 weeks after delivery, more severe symptoms characterize postpartum depression, maybe due to lack of the sleep, additional responsibility, and discomfort. But if infection or pain occur, okay, so after completion of the 2 weeks, mother having a symptoms of the depression or sadness, loneliness due to maybe stress, lack of sleep, or some responsibility and discomfort. So like pain, infection, this kind of the discomfort. Okay, so it will lead to the postpartum depression. But the severe form of a postpartum depression is postpartum psychosis or puerperial psychosis. If postpartum depression will continue for a long period of time, then it will take place as a postpartum psychosis. But for prevention of this kind of the depression, surrounding environment surrounding environment for mother is very healthy and happy, so that the mother will be take care of herself and baby also easily. Okay, so she feels safe and secure in her home. Okay, next one, that is the maternal health and nursing intervention. So which kind of the management we have to take care of the mother as well as baby in normal puerperium period. Okay, so in this section you will come to know about the nursing management also of a normal puerperium period, which include immediate care, initial observation, physical assessment, diet, personal hygiene, postnatal exercise, etc. Okay, so in the management of the normal puerperium period, this kind of the topic should included, that is the immediate care of the newborn and mother also, then initial observation, physical assessment of baby and mother, which kind of the diet should be given to a mother, and personal hygiene also maintain, and postnatal exercise. Okay, we have also included care of a newborn in brief but described in detail in block 2 to unit 5. Okay, it is needless to mention over here that the care of postnatal mother is incomplete unless the newborn baby is also totally looked after by the nurse. Obviously, mother having a need of the nurses in this kind of the care of newborn as well as the mother also, because mother have a newly experience for a newborn baby. So by help of the nurse, she can feed the baby and also take care of the newborn baby. Okay, so the mother's anxiety and stress for her newborn's welfare and care should be understood fully by the nurse, and proper attention should always be given and complain the queries of mother regarding her newborn. So mother can solve her problem and queries regarding newborn and how to take care of the newborn by the guidance of the nurses. Okay, so in specially nursing management of the puerperium period, we will include it, that is immediate care of the mother. Okay, then postnatal exercise, diet, hygiene, etc. So we will start from the introduction. So nursing care during the postpartum provides the means by which the parturant can restore her physical and emotional health, as well as gain experience in caring of her newborn infant. Okay, so nursing care provided to the mother in especially postnatal period means the after delivery, the physical and emotional health maintain of mother is very important. So it is gaining by the experience of the mother and also caring of the newborn baby. Okay, so what are the components during the postpartum period? We have to take care. That is care of the mother first, because if we can't care of the mother properly, then we can't take care of the newborn baby. So we have to take care of the mother. Then in take care of the mother, immediate care. subsequent daily care and care of the newborn or infant. Okay, these all are topic included in care of the mother. So first of all, we will learn about the objective of the care. So in immediate care of the mother, secure physical and mental rest very needed, because if mother having the many kind of the stress and emotional changes, mood swings, so in that case mother need proper sleep and rest. Okay, and restore normal good muscle tone and maintain normal body function. Obviously mother having the some kind of changes in physical means body also. So for that restoration of the muscle tone, mother have to take care of first proper sleep and diet, so we can maintain body function normally. Okay, then provide proper adequate nutrition. Okay, so by providing the proper nourishment, we can restoration of the health easily. Then guard against the infection. Mother having some kind of the pain and infection during the postnatal period. So for prevention of infection, we can provide the antibiotic and proper preventive measure. Okay, then teach the mother how to take care of her for herself and also for the infant. So by the assisting or helping of the nurse, mother can take care of herself very well and also for baby. Then foster and maintain family ties and adjust to parents to their new role. For not only for mother but also for father and new family members also, the role and responsibility will be increases. So for maintaining the family ties, the adjustment of the parents will be helpful, and to encourage for the breastfeeding by the help of the nurse. So this kind of the immediate care of mother will be provided. Then next, that is the nursing assessment. So how we will assess the mother and also for the baby. So in the first few hours after placental separation and birth of the baby, the under management of the labor ward nurse. So especially for the labor ward nurse, observation of the bleeding signs and counting of the pads, we can find out the loss of the bleeding. So by that, palpating of the fundus of the uterus through the abdominal wall. So as a nurse, we have to take care of the mother, and special another nurse provided for the newborn, that is neonatal nurse. Okay, so the labor ward nurse palpating the mother uterus for fundus. Okay, so that we can palpate the fundus and also abdominal wall. Normally, the inspecting the puerperium and perineal pad for obvious sign of the bleeding. So by the counting of the pad, we can found the changes in the local bleeding and how much amount of the bleeding loss. Okay, and by the counting of the pad. Then taking and recording vital signs every 50 minutes for the first hour after labor. After completion of the delivery, nurse have to record of the vital signs every 50 minutes. Okay, then observation of the legs for sign and symptoms of deep vein thrombosis. So we have to take care of the observation of the leg for checking the positive hormone sign. So if this kind of the hormone sign is present into the mother. Okay, so mother having a feeling of a pain in the leg. Okay, so it will show that deep vein thrombosis is a present, so the positive sign of the hormone is a present. Okay, so this is about the nursing assessment of the mother. Next one, that is the postnatal exercise. So in postnatal exercise, that is mainly included that pelvic floor exercise, abdominal tightening exercise, pelvic tilting or rocking, then rectus gap, hip hitching, and foot and leg exercise. So by this kind of the different exercise, mother can restore the muscle tones and feel relaxed into the normal puerperium period. So in the figure, you can find out how to do the exercise. We will guide for the mother postnatal exercise. So in first figure, pelvic tilt and side lying left lifting is shown. Then in next second, that is the side lying and leg lifting occurs. Okay, so by this we can side lying and left leg lifting will show to the mother. Then wall squatting. Okay, so then partial cut, diagonal cut, the plank position, dead bug. Okay, so by this kind of the different exercise, mother can restore the good muscle tone and also feel relaxed. Okay, so if you find any doubt, you may ask in next session. Thank you.